This is my office. You can go ahead and have a seat, make yourself comfortable wherever you like. Again, my name is Riley. I'm a social worker here at the agency. I've been here for about 3 years now, working with a lot of clients that have PTSD and other related symptoms. So would you like to tell me a little bit about what brings you in the office today?
My name's Claire. I've was recently hospitalized, and I left my husband after that. And it's been a couple years now. I'm having some difficulty managing on my own because things just remind me of the events that happened between us. So I'm having some difficulty sleeping. I tried to date, it's just not working out. And there's noises in the apartment. Just things remind me of the events that happened between he and I.
Okay, so it sounds like, you had a really traumatic experience in your life and just having a really hard time getting through that. You think you're finally ready to confront those issues and try to work towards better moments in your life?
Yeah, I just got to the point where I needed help.
That's understandable. Well, I'm glad that you came in to see me today. Sounds like you might have a little bit of what we call PTSD. Do you know anything about PTSD?
A little bit.
Anybody ever talked to you about that before?
Not really. Not really.
Well, a lot of times with PTSD, it's called post-traumatic stress disorder, which sounds similar to what you might have gone through in your relationship. It's just a lot of negative responses to stimuli, related to the traumatic experience that you did go through. So that's probably where a lot of your struggles are coming from, is not effectively coping with and dealing with your experience. So let me tell you a little about what we do here. For PTSD, we typically use what's called prolonged exposure therapy. It's a type of therapy that we use with clients. We use two different types of exposures called in vivo and imaginal exposure. In vivo is you go through real life situations. You kind of face those experiences that are causing you some issues, and then the imaginal exposure is we'll just talk about some different scenarios that might be of difficulty for you. These are typically done in 9 to 12 sessions that last about an hour and a half to 2 hours each. Some of the exposures you'll do at home or outside of therapy, and I'll always be there for support for you. But the purpose of these are just to help you confront those fears and issues in a safe environment, and repeated exposure to those things kind of help reduce anxiety and decrease the anxiety related to those different types of stimuli. So with the exposures, we'll also talk about some relaxation techniques, which I'll get in with here in a little bit. But again, this type of exposure in therapy is strictly used to reduce the fear and anxiety that's related to those symptoms, which seems like might be beneficial for you since it's been a couple years since your experience and helping you cope with those. Do you feel comfortable sharing a little bit more about what you went through so we can know a good starting point of some things you might want to work on?
Well, early on, he wasn't abusive. but he became paranoid, worried, like where I was. He wanted to know my every move. He wanted to, and then he began to criticize me when I would come home, and he would accuse me of things that didn't occur. And then that escalated to he hit me in the face one night. And ever since that point, I would fear that he would, hit me, and I would try to do things to keep things where he wouldn't hit me. But then it got to the point where I thought there were times that he might kill me. And then he hurt me and broke my arm. I was in the hospital, and at that point, the social workers, they talked to me there, and the nurses talked to me, and at that point I figured I'd need help. And then I was able to leave him, but I still just have this worry that he's out there, and that he's gonna cause harm to me. And
yeah, that's definitely understandable, and I'm really sorry to hear that happened to you. So it could really make sense as to why you might have some difficulties with some different things in your apartment and having relationships with different men, especially if you were never able to have any type of closure or cope with those. Do you think there's any things that you're avoiding in your life, within wherever you live, or are you trying to establish relationships, or you think you're pretty much avoiding those for now as well?
I just figured that maybe I'm not meant to have a relationship. I just don't want anybody to be close.
Okay, well, a big part of this type of therapy is to help you confront those fears. So, PTSD symptoms and fear in general is maintained through those different types of avoidances and the negative thinking and not having any good connections with, maybe anything in your home that would remind you of him. So that is the purpose of this type of therapy, is to help you redirect those stimuli and to better create that path of thinking, so that way you aren't struggling so much in your day-to-day life. Does this sound like something you might be interested in trying?
And I'm willing to try anything that might help me.
Okay, great. Well, I don't want to overwhelm you in this session today. I just wanted to give you some basics about how this type of therapy works here, and see if that would be something that you would be interested in doing. I am going to leave you with a little homework to take home. One thing that we do stress along with the prolonged exposure is to do some breathing exercises. Part of confronting your fear is just being able to teach yourself to relax in those moments. So one of the biggest things that I like to stress is just taking some deep breathing. It's going to be really important when you're facing these fears, especially when you're outside of the office and you're trying to learn how to confront those with yourself. Is taking a deep breath can really move you through that fear, because it's not going to be easy and it's going to be rather difficult at times, but it's really important in trying to redirect those stimuli in your brain to make better pathways for the things that you're having a problem with. So I'm going to leave you with the deep breathing exercise today. It's just in general used to slow your heartbeat and to really decrease your blood pressure. Those are the two biggest things that it does, along with help move you through the process of exposures. So with deep breathing, it might feel a little weird, but it's hard for me to show you today. But if you put your hand on your stomach, you take a deep breath in through your nose and fill your lungs, you should feel your stomach rise. Typically when you take a breath in, you might feel the opposite effects of that, but taking a deep breath, you'll really fill your lungs with air and expand your stomach. So that's a really good practice to keep working at. That'll help you with your fears. So for homework, I'm going to ask that you do that 3 times a day for 10 minutes each. Starting with that can help us later down the road in the other sessions too, to be able to just take a moment away. I also have a worksheet here for you that you can use. It's just on more of the rationales for why we use prolonged exposure. We like to inform all of our clients about it and let them take it home to read, because it is a very difficult therapy at times. And lastly, I'm going to give you a videotape of this session and just ask that you listen to it once before coming back next time. That way you can refresh yourself on some things we talked about and get ready to set some goals next time for things that we're going to be working towards.
Sounds like a plan.
Alrighty. Thank you for coming in today. I look forward to seeing you next time.